Joe, you want to come up and Genus Connect.
Well, I won't run over, and if I do, I'll just simply borrow time from everyone else. All right, we've begun. 43 million, that's the number. That's the number of adults that served as unpaid caregivers last year to someone they love. And being a caregiver can be difficult. Hello, I'm Joe Gleason, founder, CEO of Genus, a platform that's poised to transform the way we go about communicating and coordinating all things care, and in the process, helping to have a major impact in the healthcare system and the costs related. The concept of Genus comes from being there. I was a caregiver for my father. He suffered with dementia, and I saw firsthand the impact of being a caregiver can have, not only on myself, but my family, my mom, my siblings, and my children. And having taken 50 plus products to market, I asked that all-important question: how do we take all of these pieces of care and bring it together in a way that brings about meaning and connection? Because anyone that's been in that care process can relate. They can see that there's a huge disconnect, and it's dangerous. On one side of the equation, you have the professional providers, the hospitals. On the other side, you have the families and the caregivers trying to coordinate the most basic things. And care is so much more than vitals and visits. It's about emotional health, physical health, social health, financial health, so much more. With that information and trips to MIT Age Labs and a deep understanding of social physics, we created the Genus Care platform that brings the resources together. With that platform in place, we had to ask, who's going to be the driver? Who's going to pay us for this? How do we get this to market? Tonight, I'm going to tell you about the hospital market and why this is so valuable to them. Hospitals are under a lot of pressure. Our fastest growing age population, the 65 plus crowd, is also our most expensive to care for, 5 times as much. Medicare, trying to control these costs, has put in 2 unique programs: a penalty for readmissions, which says we don't want to see those patients come back within 30 days above a certain reasonable threshold, and a quality score system that measures the patient's satisfaction. Did they leave the hospital with a level of satisfaction, education, and support so they can go home and take care of themselves? That's worth a lot of money to the average hospital system, and I'll explain that in a little more detail. Sitting down with one of our health providers in Detroit, we found some great research. Turns out that recording the hospital discharge instructions to your mobile phone can reduce the return to the hospital by 15%. And if we can engage the family network, we can drop it down another 25%. And it makes sense. When I took my mom to the hospital twice in 1 week this February, by the time I got home, the phone was ringing, my siblings were asking what they say. And you feel clueless. You don't know how to answer those questions. So Henry Ford looked at this research and also realized we could boost the quality score and said, you know what, we're going to give you guys a paid pilot to put this on top of your Genus software. The ability to record the hospital discharge instructions and safely and securely share them with friends and family and direct them back to local resources. I'll share a little bit more about how that works in the Q&A. So combine that with the genusConnect software, you have the ability for family satisfaction, peace of mind for the hospitals, much lower cost of penalties and incentives. What's that worth? For a hospital like Henry Ford, 90,000 discharges a year. If we can lower those readmissions by 150, we're talking almost a $2.5 million savings and a bump in the quality score, nearly $6 million a year. That simple act of recording and providing proper education. What kind of traction do we have? We just received a grant from the state of Michigan, taking 3 different healthcare providers and bringing them together for the area agency, Center for Dementia, and a local hospital, all using the platform to coordinate communication better, and we're in a paid pilot, and we're just about to release the next generation of our software. So how big is the market? The business model we're proposing, $2.3 billion across 5,000 hospitals, 1,200 ACOs, and about 12,000 home care agencies. So what's our go-to-market look like? We're in pilot now, validating the research we've already found, making sure our product's adoptable. We've got 6 new hospitals getting ready to enter into paid pilots. And what's the scale look like? We've designed this to be quickly adopted within the community and quickly branded across the organization. To execute a strategy like this takes a team that's willing to dig under a lot of rocks and do what it takes. Myself, 3 startups, 2 successful exits. Pat, strong background in marketing, graphic designs. Karen Hoffman, the former president of the Michigan Medical Group Management Association, understands what it takes to implement systems in hospitals and doctors' office and the billing systems. And B2 Jacobs, our CTO, large-scale system design. So as I wrap up, I want to point out it's the kind of product that makes sense, that hospitals say, if you can prove it, we're going to go with it. The product isn't just a concept, it's for real. It has a tremendous impact on families and communities, and it's something that's exciting to be a part of. We're looking to raise $750,000 to get us through. That's it. Thank you.
What's your ask?
What's my ask for tonight?
Yeah.
$750,000 to get us through next year, so we can continue to develop the product and scale it out to different systems.
How many hospitals are currently piloting your system?
Right now, we just have one hospital. We'll have 3 more hospitals starting the first part of next year.
And how do you charge for the app? How do you price it?
So we're looking for a pricing model that people could say, that makes sense, and we want to step further and say, we'll guarantee the results. If you don't see this 20 to 1 ROI, you don't have to pay. Well, actually, you're going to pay first. We'll give you your money back. That's a much easier way to do that. But $1 a discharge. So a system like Henry Ford, if they have 90,000 discharges, that allows them to use the software for discharge and in the doctor's visits, and then we have different models that include different systems. What comes with that is we're archiving that audio, so we're reducing their liability. We're branding the audio to the hospital system, so when families play it back, they hear the message saying, Henry Ford thanks you for doing this action. And when you're done listening to it, come back to the hospital for additional resources. And here's where you go to schedule your appointments and medications. Yes?
What's your plan for use adoption?
My plan for use adoption? So how do we get it used in the hospital system?
By the family members, like how's that going to be communicated?
So when the families take home the recording, it also comes with the Genus software. So if I'm in the hospital, the hospital will say, we want you to download and install CareVoice at the time of discharge so that you can record this discharge information. When you play it back, at the end of that recording, it lets all the family members that hear that recording that's been shared with to say, this also comes with the genusConnect software, a family care platform that brings us all together. And as you share those recordings, you're actually inviting people into mom or dad's community.
So is that how you're dealing with HIPAA compliance and any liability?
So that was one of the reasons Henry Ford was really excited about this. By putting this on the patient's phone and allowing you to record it and you decide who share, instead of giving access to their system, it's just like taking that printed paper and making copies and giving it to your friends. You're in charge of it. We still have serious security protocols, the ability to share and unshare and archive, but yes, that's how we're addressing the HIPAA compliance issue. That's exactly why they liked it, and at the same time we're addressing the biggest roadblock in recording instructions has been liability. Yes.
So the idea is to charge the hospital $1 a patient?
$1 a discharge, and that's not just per patient. So a lot of times if you have 90,000 discharges, you might have hundreds of thousands of patients using it. So they're using it at the doctor's office when they take mom in. She might not be in the hospital in a readmission situation or a discharge situation for a couple of years, but the entire community is now able to start using it, and that strengthens their brand within. The $1 discharge is just one of our revenue streams that come with that. There's all kinds of additional plugins that other partners say, oh my gosh, I'm a home care agency, I'm a financial provider, I'd like to plug my software into the Genus equation. We haven't tackled that yet. We really figured let's just get adoption and meet one very clear need. Yes?
I just went through this with a family member. It can be a nightmare on trying to find out what you do and how you coordinate all of the medical care, social security, all of the stuff that comes when one of the people is taken out and nobody knows it. So is this going to have any kind of information for
That's
caregivers to do their want?
That's a huge, what we call the content component, and the answer is yes. There's a series of videos that are now being put together to help patients understand the emotional struggle, the how-tos, the technicals, the financial, the legals. because you don't know where to turn. And we're engaging the decision makers of care, and so that's a huge opportunity for additional support, yes.
So do you have a platform in there that relates to the pharmaceutical piece of that for drug dosage and?
Inside the genusConnect software, it allows you to schedule what medications mom's taking, which is actually usually far different than what the hospital, the doctor's prescribed. It allows you to produce a doctor's summary. So when you walk in, it says, Doc, I know you told us to take these meds, but here's what mom's really taking. And the other thing it does is that quick summary shows the emotional, physical observations. So every time I speak to mom, here's how she's doing. So the doctor, at a glance, can say, I can see she's been struggling with pain and sleep lately, and that's usually not reported.
Awesome. Thank you.